The issues around oral and dental health for patients with diabetes mellitus, there's a couple of issues that patients, once diagnosed with diabetes, need to consider. The first thing is the simple things that all of us need to be appreciative of, which is the fundamental importance of just good oral health, and that starts with just having good, regular oral hygiene. So regular toothbrushing, use if necessary, particularly if indicated, of floss, and what we call interproximal cleaning devices. So these are devices that facilitate people or help people to clean between their teeth. Now, as the ads show increasingly on TV for various oral health products, most of what we call plaque, which is the adherent bacteria plus food products and debris onto the surface of the teeth, is in the hard to reach places between the teeth. And that's where, unfortunately, people need to concentrate in terms of their oral hygiene habits. Now, when we talk specifically about patients with diabetes, there's really three major infections patients need to be aware of. The first, and one of the commonest, and is prevalent in the broader community as well, is simply dental caries, that is tooth decay. Now, caries is a complex infectious condition, particularly associated with particular types of bacteria, which find it very easily and readily adhere to the surface of the teeth. So the second common disease we commonly encounter in diabetic patients, and is significant because there is what we call a two-way interrelationship. So the presence of the disease makes the diabetes worse, and conversely, the diabetes makes the disease worse. And the disease I'm talking about here is periodontal disease. Some people refer to it as pyorrhea or gum disease. Now, the consequences of periodontal disease, if it's undiagnosed or untreated, is the teeth become progressively loose over time and literally fall out. Or worse, they're subject to recurrent acute infections with localized swelling or more severe swelling that might be visible as facial swellings and fever. Now, that in turn leads us to the third commonest infection we tend to see in patients with diabetes, which is important to look out for, and that is commonly known as thrush, but the causative organism is a fungus called Candida albicans. And when we see Candida albicans infections, and there's several types that we can see in and around the oral cavity, that's an important clue that maybe the diabetes that the patient has is not as well controlled as it should be. And again, the consequences for diabetic patients from these infections is far more severe. We know again it tends to impair their glycemic control. Conversely, their ability to combat or address such infections is also impaired, and there's a variety of reasons for that. So these infections tend to be more severe, not necessarily more common, in patients with diabetes. Should diabetic patients see the dentist? The answer to that question is absolutely yes. Should they be seeing them with what frequency? At least once a year if they've got stable dental disease in terms of dental caries or periodontal disease. But if you've got active dental decay or more commonly worse or progressive periodontal disease, you need to be seeing your dentist possibly more frequently. Certainly seeing the hygienist for more regular cleans, and patients with difficult to control periodontal disease may actually need to be referred to a specialist dentist called a periodontist who specialises in gum diseases and their management. What it does mean, as with a person with diabetes, needs to be conscious of, you need to be attending the dentist more regularly, possibly more frequently than some person with not diabetes. You need to be conscious of the importance and value of regular oral hygiene, which you need to do, but of course it needs to be supplemented by what the dentist can do for you. And the important thing is, there is no reason for a person with diabetes not to have their teeth from the day they're born to the day that they depart this earth.